What can you do which will make you live 10 years longer?
Scores of humble dwellings were turned into graves. Hundreds of bodies were sucked up.
In Times of India, my one full interview came that this is a trauma generation. They are adolescents. Their brakes as such are not so strong as are their accelerators that we know.
I felt worthless. My staff, they got frustrated. I would scream and shout at them. Even slightest alteration in normal I couldn't tolerate.
Our
guests, senior professors who come out the way long to take part in the Symposia on mental health, public mental health.
The ICD-11 has included complex PTSD as one of the criteria.
Today, we also look forward to having more in collaborative programs as far as psychiatry, rehabilitation, and all that's concerned.
After this earthquake, she says she's almost again symptomatic. She's getting same symptoms because they are living in the same locality where that snowstorm had occurred. They're almost near the same place, and she says that she's getting thoughts that
It is one of the best centers. Earlier, I came with my teacher, Professor Mahmood Sawab. I think it was 10 years back.
This should be the understanding that there are such adversities in the life which you have to confront and which you have to develop resilience to and adapt to it and move on in this life.
People with mental health problems don't go to physicians, especially in traditional societies. They go to religious leaders, they go to their elders. So it was extremely important to involve every aspect of society.
We are seeing many patients at our OPDs, but the way they describe their main features, it was out of what we are learning from books.
Her husband has died. She has 4 children already. She is pregnant.
Sarah has a data of patients over 20, 30 or 40 years. If you could see the slides, 2002, 2004, 2017.
More than 5 decades have passed since this organization was established.
Change is the essence of life. This ever-changing world of ours is governed by an unending flow of ideas, intentions, and actions. That's how repositories of knowledge and experience are created, which in turn get replenished by the abiding flow itself. And that's why platforms and forums of knowledge sharing are subscribed to by fields of specialized human activity in the shape of conferences and seminars. In the beautiful landscape of Kashmir, matters of the mind were recently brought into specialized focus, courtesy of a 2-day conference organized by arguably the most eminent psychiatrist of Kashmir, Dr. Mushtaq Marghoon. The conference could probably not have asked for a better location, since life in Kashmir would remain on a perilous edge until not very long ago. The 2-day conference brought together mental health professionals and other medical professionals of international repute, who got to share their knowledge with young doctors on a wide range of topics integral to the human mind in general and its study in particular. Thus, the conference proved to be a worthwhile forum for ideating and brainstorming on matters of the mind. Dr. Mushtaq Marghoon has always believed in the significance of gathering knowledge from practical experience. He would groom his trainees on similar lines by allowing them to get a first-hand feel of traumatic situations in and around places struck by disasters. Being a regular faculty in conferences of national and international level, Dr. Marghoon is amply seized of the worth of such forums. Way back in 2005, when the general situation in Kashmir was quite trying and traumatic, Dr. Mushtaq Marghoon organized a one-of-its-kind national-level postgraduate development conference on traumatic stress, wherein distinguished faculty from across the country got to share their knowledge. It was this conference that enabled budding psychiatrists from Kashmir and other parts of the country to widen their professional horizons and, in the process, ensured a churning of sorts for the field of psychiatry in Kashmir itself.
Learning has no age, and teaching also has no age. But we need to develop a mindset that we need to learn. There is time for extravaganza, there is time for picnic spots and other things, they will come and go. But learning from teachers of their caliber is very, very important, particularly once we are discussing disasters in the perspective of Kashmir that we have seen, we have gone through. So may I call upon the first speaker of the day, Professor R. Srinivasa Murthy.
It's a special privilege for me and my wife Radha, who is here in the audience, to be with you all. As all of you who have been living in a conflict situation for the last 2-3 decades, it changes you much more than clinical psychiatry does. Clinical psychiatry, we go there as though we are seeing someone ill and try to make sense. But when you see a person going through, reacting to the disaster, you are seeing the real life experience of human challenges and methods of coping and resilience. What I want to share with you is the experience of working with Bhopal for last 40 years. This is the 40th year. In Palestine, I worked there for some time. In Iran, I've been there many times and worked there. In Iraq, I was the medical officer in charge of the mental health program of Iraq for about 2 years. In countries like Rwanda and other places, depending on the time, Djibouti, which I'll share with you as stories rather than giving any statistics. Iran is one of the best countries to address disaster work in the whole world. You all know that 1988, 80 to 88, they had an 8-year war between Iran and Iraq. Literally millions of people were handicapped, dead. What they did was fantastic. I visited them, Dr. Big visited in 88. After that I went in 89 until about 10 years. I used to go every 2 years or so to work with the population as a WHO consultant. One of the first things that they did was, for every 50 families, they identify a care worker who will coordinate medical things, social things, legal things, every aspect of it, they would take care of it. So there's no running around. Get this certificate, have this one. That's what happened in Bhopal. So lots of irregularities occurred. Number 2, they developed a system of what is called as behwazes, community level workers, one for 2 people for every 1,000 population, one of the best ways to provide care, and they integrated mental health. And they used to, for every village where you went, there was a thing called horoscope, like Indian horoscope, where you would have ANCs and all the types of things. And they integrated mental health in that one. So what we need to do in Kashmir, with the type of a history that you have had, is to recognize the right of the people to tools to recover and rebuild their lives. And we should become the agents of change, and we should become the catalyst rather than pathologize it. And if you can do that, you would have rebuilt your society, and you will be, as a psychiatrist, for example, I will never regret getting involved with the disaster mental health work because it has made me better. Just to give a personal note, 10 years back I developed cancer, stage 3 colon cancer. I'm still standing here, partly because of the skills that I learned from working with disaster population. I learned to accept it, to develop. I've lost about 30 kilos, become healthy, practice, and much more than that, spiritually grow up. And that is possible for all of us. And it is that which I want to leave it to you as a message of my lifetime work in this area. As I said, at the back of it where there is a table, my email is here. Write to me. I am with you in your journey. Thank you very much.
We move on to the next speaker of the session, who is none other than Professor Mohan Isaac.
This is just, whenever you talk about what are the disaster consequences trauma occurring in a big way over a long period of time, what are the psychological consequences? When you look at the literature, you find that it has taken a long time for mental health effects. Dr. Murthy mentioned about the ICMR, how when the thing occurred, ICMR passed a resolution, but it took 2 or 3 months for them to react. But if you look at the field of mental health, it has taken a long time. And very quickly, this is a story. First time ever psychological consequences were talked about or written about was after the Chicago fire, 1871. There, subsequently, there have been lots of, talks, presentation, but it was during the World War I that terms like shell shock, battle fatigue, combat stress, etc. came up. It was during the World War II, talk about your experiences, that the theme came up. They found out that soldiers who withdrew because of these psychological relations, problems, etc., they were any of these shell shock, battle fatigue, combat stress. The doctors realized, who worked in the war front, realized that if the soldier were asked to explain what they went through, how it was, etc., they were ready to go back to fight again. In India, of course, the greatest thing which has occurred, which has now gone on to the next generation, is the trauma of the partition. A lot of people talk about it. I am not going into the details of that. But in more modern time, disaster psychiatry in Indian psychiatry came up after the work which Dr. Murthy referred to. I was also working in the department at that time, and there was this Venus Fire circus. The circus, lot of young people, children, and school holidays, they go, and the Venus circus was a very popular circus. They come a camp, lot of animals, etc. There was a fire tragedy, a lot of children, many mothers died, and subsequently, of course, the Bhopal gas leak tragedy. Then, of course, the Gujarat, Orissa, and many other places, Kashmir included. I do not want to talk about it. Much of what I have done in India is about community mental health. It started in Sakalwada. Dr. Murthy mentioned about that. We went on to develop the mental health program in a primary health center involving primary care doctors, health workers, lay health workers. It was expanded to a district. It was tried out in Bellary, and now that Bellary model is the prototype of the district mental health program, which, according to Government of India documents, is being implemented all over the country, at least in 600 plus districts. The real topic for the day, the long-term recovery and what has to be done, will be talked by somebody whom all of you know, who has been working in this area for the last 30 years or so, and I would stop here. Thank you very much for your patience.
Assalamu alaikum, good evening. Maybe I don't speak too much, and I would take you on a virtual tour with me, what I have been doing in the community. That would even explain what he said, desnos or other things. I would tell them, because what I wish we had, one can discuss days and days. That is what happens when I go to any international conference. People ask, how do you know this? I tell them that I have been taught by thousands of my patients. They are the sufferers, they are in the community, and that you would see a reflection of that. So I start with that. Respected chairpersons, esteemed faculty of European Psychiatric Association, faculty from different fields me here in this knowledge exchange course. They are working with it, but anyway, I had just one question only to ask, but they are not able to project that. But anyway, the question was that during the last 1 month, that is April 2010, how many patients of PTSD did you treat? here we are. This means that yes, PTSD is there. We have seen, this is one of our studies, in fact, where you find that chronic patients who in fact seek treatment, although they are supposed to be atypical of the cases and only rarely do they seek treatment even in the most advanced places of the world. These are two of the community studies wherein in fact in mass trauma situation 15% of population, this is throughout the whole Kashmir area that we took this sample, 15% people had, more than 15% had lifetime prevalence, and 7.5 was in fact the current PTSD rate, and 18% was in a snowstorm. Professor Casper is not around. I'm thankful to people who have appreciated my these humble kind of efforts. Professor Salkowski and Professor Denstein, who has also worked a lot on anxiety, and in fact they also appreciated this. This is actually the journal, 20 articles that have been put on the web. So any of you who is interested can simply write Mushtaq Margoob in the Google Scholar and get all these articles on post-traumatic stress disorder in children, following adulthood consequences of sexual abuse, and all these references.
Is PTSD a valid diagnostic entity? Is I think, a very tough question, because we have got a diagnostic criteria. Why do you want to label someone with PTSD, post-traumatic stress disorder? There's an etiological connotation, though in a phenomenological diagnostic category. Okay, then is PTSD is a American Psychiatric Association diagnosis or a fashion. So why this etiological connotation has crept into our phenomenological diagnostic?
See, it is at present, if you see post-traumatic stress disorder, when we talk about post-traumatic stress disorder, we usually talk about the chronic part of it. And in fact, if you see, whether you see neurobiologically also, you have specific, in fact, evidence to show that this is as real a disorder as are all other disorders. And in fact, simply because this was first detected in Vietnam War veterans, this term only, not that trauma and trauma. If you go back to in fact, earlier times when trauma was supposed to be associated with kind of even hysteria, the explanation was almost the same, that trauma and all those processes. But at present also, in fact, whether you give it a post-traumatic stress disorder name or you don't give it, but there is a definite entity which follows this, and then there is a change that earlier this was supposed to be a normal reaction to abnormal circumstances.
Do you believe in it?
I want to clarify one thing here. It is not something which is specific to Kashmir. That was the reason that I had got some of these case reports with me, wherein it is clear that these events might be taking place everywhere, but who does see these patients? For one reason, this was a man, 18 years, he's a married person, but in spite of that, he has never divulged this to his family. So obviously when he comes to us, secondly, he will develop depression. In depression, we will treat him as depression, and we would never, unless we ask him and are very particular about the trauma-related history. So it is not something which is specific to Kashmir only.
Is it the American Psychiatric Association fashion diagnosis? No, Mushtaq from Kashmir also endorsed it.
That he was complaining of flashback of that episode flood.
इसकी प्रॉब्लम तो मुझे 92 से हुई है, बहुत 100% श्योर है कि 92 से है। पूरा पिक्चर, पूरा सीन, क्या हुआ, किस तरह हुआ, कैसे हुआ, सब मुझे पूरा याद।
टॉर्नेंशियल रेन्स, बारिशें बहुत हुई थी।
एक फ्लड के, एक पानी आ गया, पानी की शक्ल में बहुत बड़ा सैलाब आया। मैंने देखा अपनी आंखों से, उसी ट्रैक के ऊपर दुकान थे, है ना, बहुत बड़े हैवी, मतलब अच्छी तरह से बने हुए थे। तो उनका भी नाम वली लगा, उसको 2 बजे तक पानी चलता रहा, लेकिन आखिरकार मिलाकर जवाब देगी 3 बजे, वो भी बह के लेगी। उसके अंदर जो ही बारिश और बादल आते हैं, जो ही बारिश और बादल आते हैं, जो ही, तो मैं चाहता हूँ कि ये बादल ना आए, ये बारिश ना बरसे। तो आमदी फार मतलब उसी ट्रैक के ऊपर सर, उसी ट्रैक के ऊपर ये मुझे 100% प्रेशर डालता है। खैर ये मामला सर चलता रहा, लेकिन जब 96 में शेलिंग शुरू हुई, फायरिंग कहाँ हुई ना, बड़े बड़े गोले आते थे रात दिन में, फिर हमने बैंकर इस्तेमाल किए, हमारे दाएं बाएं आगे पीछे गोले पड़ते रहे। 96 मुझे पूरा याद है, 13 दिसंबर था, शेलिंग चल रही थी, फायरिंग आ जा रही थी। एक बेचारा वो बीकन वाला था कोई अफसर, वो बाहर का, वो लगभग सिर्फ आधा घंटा पहले घर से मतलब फ़ोन करके आया घर वालों को, कहा मैं ठीक ठाक हूँ, फर्स्ट क्लास हूँ, उसको शल आके पड़ा वहाँ, ये मर गया। ये तो बड़ा सदमा है सर हमारे लिए। फिर जलजला हुआ तो एक प्रेशर 92 का, फिर 96 से 90 लगभग 2003 तक सर, फिर ये प्रेशर पड़ता रहा। अभी परसों ही लगभग 10-5-6 दिन पहले तो मुझे वो बू आई, 92 की बू आई, सोया हुआ था, बारिश पड़ रही थी। हाँ, बारिश पड़ रही थी, मुझे बू जैसी है।
क्या वही वाली उस वक्त?
हाँ, उस वक्त वाली बू जैसी है। जब ये मामला आता है मैं सोचता हूँ शायद पर्सनल मेरे ही लिए है।
अच्छा, आपको लगता है
जैसे मेरे
होने वाला है आप कुछ मेरे साथ?
हाँ, मेरे ही लिए है। अब जिस कमरे में सोता हूँ तो क्या है डॉक्टर साहब, मैं उस कमरे को कपड़ा डालता हूँ, मतलब ग्लास रूम, मतलब उसके ऊपर जैसे
बाथरूम
का पता ना चले। गुस्सा आता है सर, गुस्सा आता है, किसी से झगड़ नहीं सर, ऐसा होता है। मैं कहता हूँ मुझे झगड़ा किया क्यों? हमारे साथ और भी दाएं बाएं वाले बसते हैं, लेकिन ये कहता हूँ ये पर्सनल मेरे ही लिए है, मैं ये समझता हूँ सर। है ना, शलन होगी तो मुझे लगभग 30% मुझे प्रेशर पड़ेगा, कुछ और मामला होगा लेकिन मुझे 30, लेकिन जो ही बादलों का आना है मैं एकदम सोचता हूँ ये बादल कुछ 92 वाला लेके ना आए, ऐसे ही रहता है, तो जिसकी वजह से फिर प्रॉब्लम। एकदम खुला हुआ इंसान एकदम ऑप्टिमिस्ट।
I see this young generation, I would call them trauma generation, and in fact when things would be very bad, I'm not so accessible now to media, but earlier in fact you would have to give a statement. In Times of India, my one full interview came that this is a trauma generation, they are adolescents, their brakes as such are not so strong as are their accelerators, that we know. So once they develop that, once there is a normal circumstances, they behave normally. But in abnormal circumstances, this is innate kind of a thing where they would take risks. You would see media plays an important role. Next day, Barkhadat comes over here and they say that we have called universities, all students, please can you spare some time because this is trauma generation.
In preventive strategies for the sequelae of traumatic stress, media, which earlier stigmatized any psychiatric patient, has started playing a new and positive role. Education in disaster stress is being addressed by media to increase the awareness of masses for better coping of traumatic stress-related problems.
We wait for Dr. Mushtaq Margoob, the state's most famous psychiatrist, and also a kind of messiah for thousands of Kashmiris. Soon we get a glimpse into the private hell that makes up these lives.
Her father got killed some 8 years back, bullet injuries, and she saw his body, mutilated almost that body, and then she completely withdrew from all social and other activities. She refused to go to school, and finally she refused.
But strained nerves and scarred minds. On both sides of the wire, people are living under psychological siege.
Dr.
Mushtaq Margoob is the state's leading psychiatrist. His female patient, one of Kashmir's hidden victims. As a young child, she suffered the agony of seeing her father murdered. Ever since, she's struggled to sleep and is painfully withdrawn.
PTSD in children may be expressed by disorganized or agitated behavior. Exposure to the grotesque aftermath of violence, events that involve harm to children and abusive violence are particularly likely to lead to PTSD.
This was a voluntary. What?
Mem snaid se bana doctor ban duban sugo jale asal agar bu baije se kunto baban doctor because of the sir tension some attention ki be parna bi bent boy di pane padin da smaina den da experience je das ne matait shi na semana da moje ash me mar men sikel me mar ay mish mar bish zvada mo dir go sahat tam if here it comes 80 activating men bas wushin chia jigr me apa hakka me apa lose.
We are so important at times, especially under such circumstances, and every time what you say has to be based on your own observations as well as whatever literature tells you. Excepting for Bhopal gas tragedy, where from 84 Professor Murthy has been working, but there were many, restrictions about publishing that data at time that would have helped a lot. I had a track with them till 2018. After that, I don't know what happened to them during COVID. Do you know how they were compensating their grief and other things? Enormous prolonged grief reactions you would see. And on every Saturdays they would come to a park, they would sit, and that is how they were processing it.
सांस की पोजीशन हो जाती है कि मगर अभी जो सांस हो जाएगी उसका मतलब आप काम उस तरीके से कर ही नहीं पा रहे हैं जैसे आप खुद अपने आप को नहीं संभाल पाता काम कर
Recently, the tsunami has in fact changed the scenario in the country. Earlier, almost we were in a state of denial.
Over the past few years, the professionals have redoubled their efforts to address the issues of traumatic stress following various disasters. Non-psychiatric experts and primary care physicians have been playing a very vital role in the delivery of integrated healthcare, and the mental health care is evolving as one of its important components. Debates and discussions as relevant coping mechanisms provide an excellent opportunity of coordinated professional efforts to develop effective methods for the management of sequelae of traumatic stress and disasters.
Psychiatric or otherwise, organic or inorganic. For me, it is okay. I can accept it. But how do we convince the rest of the world?
Thoughts are molecules. Thoughts are things. When you say something, it is not something vague. It is in the shape of molecules.
And if we see a heart rate of 30, the next thing we jump to is a pacemaker. Now, a person who is doing the yoga can control it. And similarly, in Islam, if you do zikr, you can control your voluntary mechanisms of the body.
What I'm trying to say is these patients are seen every day by psychiatrists, by physicians. So these patients cannot be referred to mental hospital.
This is a privilege to share with you some of our experiences as far as this disaster, which most of the times physicians have been doing really a great job in handling these, because we have been only a few psychiatrists. So multiplying hands has always been our joint motive. The interest in disaster management, in traumatic stress has increased in developing countries also. And unfortunately, this was precipitated because of the recent tsunami in which about a dozen countries got affected. There were earlier also disasters. Disasters have been more in developing countries, and the impact has been more in developing countries. But for various reasons, we were in a state of denying that, yes, is it really that trauma-related disorders are less in our settings, because most of the models are from the West, which are alien to our socio-cultural perspective, to our ground reality.